Hello people, in this video let us look at this book Exam Preparatory Manual for Undergraduates by Ramdas, Nayak, Rakshata Nayak. So this book is used by students, that is why we are covering it. Otherwise we would recommend a proper textbook. And this is no smaller in size than your textbook. So anyways, let's look at it as a review. So the contents here: general pathology, cell injury, inflammation, infection, okay, then hemodynamic disorders, hemorrhage, edema, etc., immunopathology, AIDS, amyloidosis. Amyloidosis is the protein deposit, abnormal protein gets deposited, okay. Neoplasia is cancer, right? Then you have the, where is 8? 7 I see, 8 is here, okay. So genetic and pediatric diseases, and 9 is environmental and nutritional diseases. That will be your protein, energy, malnutrition, etc. That's it. So here they are talking about what I like here is cytology. They're talking about that study of cells, right? So fine needle aspiration cytology, FNAC, that's what they talk about. So you have biopsy where they take tissue, and FNAC where they actually take only the cells, right? And to diagnose neoplasia and to grade cancer, right? Pathology is your bread and breakfast for that. What am I saying? Okay. So basically, coming to the next section that is talking about hematology, they're talking about anemia, a lot of anemia they're talking, right? And then white blood cells, what are the disorders? Hemostasis. Hemostasis is something to do with, what are they talking about? Bleeding, isn't it? Bleeding disorders, hemostasis, blood stability of that, right? So it should not bleed basically. Clinical pathology, focus here guys. Then systemic pathology, they're talking about cardiovascular, severe systems, respiratory disorders. See, at least you should know respiratory disorders means what and all will be there. Bronchitis, emphysema, asthma, obstructive lung disease, bronchiectasis, infections, pneumonia. Then lobar pneumonia, etc., 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 tuberculosis, sarcoidosis. Sarcoidosis is coming under respiratory disorder, is it? Okay, then continued here. Okay, that's it about respiratory. Similarly, you have about kidney, urinary tract, genitals, right? Hepatobiliary system, pancreatic disorders they're talking about. So anyways, this is about pathology, guys. We're looking at the contents: breast, skin, endocrine disorders. And I get a special mention, interestingly, okay. Now guys, basically this book is an exam preparatory manual, correct? So what should it have? It should have question and answers, right? Let's see. We'll just take general pathology, what they're talking about. Where is the question? Is there a question that you see here? See, interestingly, I don't see any question here. Okay, here question here. Write short note on causes of cell injury. Hypoxia will cause cell injury, ischemia. Then what else? Types of cell injury response. Okay, cellular response to injury, that we don't want. We want the causes, right? So the most common cause of cell injury is hypoxia. Then the most common cause of hypoxia is ischemia. Wow. Okay, then because of mechanical trauma, thermal injury, radiation, pressure, electric shock, because of chemicals, there can be injury. Okay. Then, is there a D here? Yes, because of infection, there can be cell injury. Okay. Then, because of immunologic, autoimmunity, then genetic derangements, etc., nutritional imbalance. Okay, then aging, idiopathic. Always write off on idiopathic everywhere, right? Always in any cause, you'll write off on idiopathic. So for this, if they just ask you the causes, is there any table that they have given here? Nature of stimulus, cell response. So they're talking about response here. Nice. So basically they asked only about causes, so that here they have not mentioned, right? In this they are talking mainly about types of cellular response to the stimuli, to the cause of the injury. And here they are talking about different stages of cellular response, This book is used a lot by students. You can see here how much they have marked, right? However, I did not use this. I used only Harsh Mohan. And I didn't even use Robbins actually. Wow, looks like people are like eating this book. Nice. Though it's a library book, people have marked it extensively. and even the condition of the book is quite used. So now look at this. This is blood. I'm able to see that this is a blood smear. So you have to draw these diagrams, and this is a hand-drawn one, right? This is very, very important because in the exam you have to draw, you have to color, okay? So this is how it's appearing under the microscope. Sickling test. So they're showing you sickle cell RBCs. Focus, guys. So I think this is something to do with the blood hemostasis, is it? That chapter name. So a lot of tables, lot of information, diagrams. See, what you need for pathology is one microscopic diagram and possibly one gross image which you can draw. Very, very important for you to have those as a reference, right? Now look at this. What is this? Bronchopneumonia, characterized by infiltration of bronchi, bronchioles by an adjacent alveoli by acute inflammatory exudate. So they have drawn a lot of neutrophil everywhere. So they've drawn one, what is this? Bronchiole, right? Inside which they have shown neutrophils, outside they have shown neutrophils, and they have shown some blood vessels also, congestion they have marked, and a lot of edema fluid. So this is bronchopneumonia. So you have to draw these diagrams. That time only you can pass pathology. Pathology is all about your gross and microscopy and pathogenesis. That is how the disease actually is evolving, right? Let us look at pathogenesis. See, here there's a very nice diagram, pathogenesis of acute pancreatitis. Okay, so here's your acute pancreas. Then there's an obstruction of the pancreatic duct. Then what are they showing? Okay, all this and then something, all this lead to acinar cell injury, because of which the proenzymes will get activated to activated enzymes. So the proenzyme is what? Your trypsin, etc. Right? So once it becomes, so what is it called as? Trypsinogen will become trypsin. So what will happen? The activated enzyme will start eating the pancreas itself. So proteolysis by proteases will happen, fat necrosis by lipase, etc. So what will happen? The activated enzymes are getting activated where they should not get activated. So there is acute pancreatitis. And you should always write 2 lines about the treatment also. Symptoms, treatments also you should write. Then only you will get a clear picture about the whole disease, right? So pathogenesis, guys, are you focusing? Pathogenesis, very important. And then your gross and microscopy, and 2 statements on the symptoms and treatment also will get you marks. Okay, main treatment you should write. Goodpasture syndrome, they have marked a lot, so you can look at that. So it's about your kidney, right? Goodpasture syndrome. Looks like they have marked it as some 2 marker or something, right? So there's a question here, short essay on Goodpasture syndrome. Pathogenesis. See, it's better to have a lot of diagrams which explain things to you. So this book has diagrams. So this is called as an exam preparatory manual. Quite a huge book. So it's up to you to decide what you want to read, right? I wouldn't recommend this though, because we don't know how many mistakes are there in such types of books. Anyways, so guys, look at all the other textbooks and make your choice. Bye bye.